I did my endodontic training in Israel in the medical school in Jerusalem, Hadassah Medical School, where I did a 3-year training in endodontics and then a year fellowship in pediatric dentistry and another year fellowship in maxillofacial surgery. From there, I stayed as a tenured professor for 10 years and has been in the US as tenured professor at UW and in charge of children's and traumatology for the last pretty much 25 years. There is an international association that is the only one actually in the world that is an organized dentistry association dealing with dental traumatology. I'm currently serving as the president-elect, which entitles me to be actively involved in the protocols and meetings and scientific material that is being developed. Trauma, it's actually a multidisciplinary field. So there's really not one single specialty that can take care of all the cases, comprehensively. So we take, care of everything. I'm as an endodontist, but mostly also as a traumatologist, I have to treat and diagnose soft tissue injuries, hard tissue injuries, including fractures of the jaw or the teeth. And of course, like I said, luxation, fractures of the crown, and avulsions or knockout teeth. So it's a whole range. Well, dental trauma is very important because number one, the frequency and incidence is higher than people may think. One of the things is that, in general, in epidemiology speaking, we are seeing trauma in about 30% of the general population. In children's alone, actually, we already see about 22 to 34% trauma in which country of the world. So that is quite high, and the consequences of the trauma, of course, are very significant. It is considered to be a disability legally, so it is going to involve first a major aesthetic problem, phonetics as well, and function. But all those three combined are, like I said, considered legally to be a degree of disability for the patient because that's going to be throughout their life. Moreover, the rehabilitation of a patient that has lost a tooth due to a traumatic injury is extremely complex and extremely expensive. So it should be either prevented if possible or treated immediately after to preserve or try to save the tooth that has been injured. Within children, actually, it is very common to have injuries at home, at school, a lot of them, and in between, which means anywhere like parks, camps, streets, etc. In children and adolescents, we see a lot, just for example in school, if we look on a graph, we can actually see that there's pretty much an equal, which is the blue bar. So you can see that it's pretty much equal, falls, sports and violence. All those three are pretty much equal reasons of trauma within the school system. If we talk about home, then we see a major impact in falls and sharp objects, which is very concerning actually, meaning, leaving sharp objects just unattended. It's a big concern regarding dental trauma. In between parks and streets, of course, we see mostly bike accidents. We see a lot of motor vehicle accidents as well in sports, especially when we're talking about sports. So those are the main causes related to trauma in that age. Adults, on the other hand, they're more susceptible to trauma. Mostly the number one reason would be motor vehicle accidents. Mostly, I would say 3. One of them is crown fractures, which means an infraction of the crown. We can see here, for example, one example of that. And here we see a more severe fracture, way deeper, that also in this case was a child, which has been immediately restored. The second most commonly is displacement or luxation of the teeth, which means that the tooth has moved from one position to another. And third most common is by far a avulsion or teeth that are knocked out during training or official competitions. This is a patient again which had lost one of his central incisors. He's a child, but actually in this case, yes, he did actually lost that during soccer and playing in a camp or a training field. So those are the 3 most common injuries that we see.